And you have to buy it in such big amounts. Most of it.
Huh?
You have to buy it in such big amounts a lot of times. And
Oh,
you go,
sometimes,
"Oh,
yeah. Bulk.
Don't need 20 of them, I just want one, you know?
Yeah, right.
Yeah, you can't.
Yeah, just one.
So we're supposed to eat our brains?
I did.
I know, right?
Are they good?
Yeah, good. Yeah.
Gummies.
You go camping over Labor Day?
He was
I
on
haven't. No, you gotta.
Susan and I decided we would talk, we were trying to think of a topic that we haven't discussed before, and we thought we would talk about brain health and kind of incorporate some brain games, because we know that research shows keeping your brain engaged and active is really good for keeping your memory, strong and acute, and in overall function, emotional well-being, physical well-being, and intellectual well-being. So we thought we'd have some fun with it. I don't know if you could see our shirts say brain waves. So we're just, brain waves today. That's what we're doing. Yeah. So we thought we'd start by a little bit of fun facts and trivia about your brain, and then we'll talk about the brain as an organ and a structure, and then we'll kind of have a little interactive brain game so that we can do our exercise and practice what we preach a little bit. So you have a handout. The first one looks like this. And actually, this was, we were kind of scouring for some updated, interesting information, and this was actually an article that we found online presented by Cleveland Clinic. So these are just some kind of fun facts to know about your brain, and then you can go and tell your friends. So the adult human brain weighs about 3 pounds. And just so you know, a bigger brain does not correlate to higher intelligence.
That's what I thought about Einstein.
Right? Yeah, that's it. Right, the little note here says, after all, Albert Einstein's brain weighed a rather average 2.7 pounds. So nothing special or fancy or big about his brain. Well, it was special, but it wasn't bigger than normal.
I made the most of every ounce.
Yeah, he did make the most of every ounce, exactly.
Yeah, right.
I think it's cute. The next picture shows those kids with the little light bulb helmets.
Isn't it adorable?
It just says, your brain generates enough electricity to power a 25-watt light bulb, which is pretty significant when you think about it. There's an interesting fact that we found, that a small part of the population can actually experience what's called synesthesia. They may hear colors, smell words, or see a concept in a spatial location, which is just interesting that some people's brain works differently like that. Some people would call it that sixth sense or ESP or something like that. I guess it was first discovered in the 19th century, and the mixing of the senses is actually a perceptual condition. While synesthesia may be caused by brain trauma or degeneration, many people report symptoms from an early age. So it's just kind of an interesting thing that some people can actually hear color, and that would be interesting to research a little bit. So the number 4 was, the reason why we dream is still a scientific mystery. Some scientists believe that it's just your body's way, a natural way for your body to exercise your brain even while you're sleeping. Others claim it allows the brain to fully absorb all the thoughts and memories and process everything that you've done throughout the course of a day. But the bottom line is, we don't know why we dream. It's interesting as humans that we do. This is a funny one. You can't tickle yourself because your cerebellum prevents you from doing so. And I'll show you, this little brain model is actually to scale. So this would be a typical sized brain. And the cerebellum is actually this little dark piece that rests underneath the bottom here. And that's the part that won't let you tickle yourself.
That's a good thing.
Yeah. This cerebellum, this little piece here that's tucked, I'll show you this side here, toward the back and the bottom, it's actually responsible for your physical movement and can predict the sensation and prevent a response. And then there's a little fun fact that says evolutionary scientists believe that tickling behaviors developed in primates as a form of social bonding. Kind of interesting, right? Your brain uses at least 20% of the oxygen in your body. That's about 3 times as much oxygen as your muscles need. You'd think so, right? Considering it's our mainstay of our whole being. There are no pain receptors in your brain, so you can't actually feel pain. Your brain can't actually feel the pain. All right, here's something that's not true. You definitely use more than 10% of your brain. There's all kinds of theories about how much of our brain we actually use. There's been a rumor that says if it's not part of the brain, it's not being used, and you're only using this small part. But that's not true. You're actually using more than 10%. Most people, I think, have heard this, the difference between the right and the left brain, and how if you're the fun fact is that most right-handed people process language on the left side of their brains, but left-handed people sometimes show activation on both sides. And there was, in our research when we were putting the talk together, there was a lot of CAT scan and PET scan and MRI imaging which would show different activation in different parts of the brain for whatever it was, the question that was asked of the person, or if they were asked to do a movement, and it was kind of interesting to see that. But most cases, the brain is working both sides of the brain. So that's that one. So let's look at the actual brain. Again, we said it's like about 3 pounds is average. This is about the average size of what your brain actually would be. There's 3 main parts. So the cerebellum fills up most of your skull, and that's what this part is. It's involved with problem solving, remembering, thinking, feeling, and I can break that down for you into actual parts in a minute. The cerebellum is that little one that sits at the back of your head, and it controls coordination and balance, which is kind of interesting. As we get older, the balance can get tricky for all of us, and you wonder, right, what part our medications might, but maybe our brain is changing as we get older too, and that cerebellum might be changing and affecting our balance and coordination. The brain stem, this guy here, is kind of tucked way at the base of the brain, and that's the part of the brain where it's connected right to the spinal cord, and it controls those automatic functions that your body does without thinking about it. The breathing, your digestion, your heart rate, your blood pressure. So the brain stem is really kind of the root of all of your core body function there. So those are the 3 main parts of the brain. And then if you look on the outside, you know how it's kind of got the texture of like a firm jelly, actually, which is kind of gross, but it does. Kind of like your candies, probably. That you all ate and enjoyed. So the brain is kind of, it's got these little wrinkly texture, and that's actually called the cortex. It's the outer layer of the brain, and I like how some people call them the thinking wrinkles. I just think that's a neat little phrase for it, but that's the cortex, the outside there. I'm losing my little tags here. All right, so let's talk about specific parts of the cortex. So if this is your brain and this is the forehead part, right? So your forehead is dealing with thoughts and planning and processing and problem solving. Anyone have any idea where it might be responsible for sight? Anyone ever heard? It's actually way at the back of your head on this back portion, which has to do with your sight. Other parts, so around, actually almost on your temporal side, is smell and sound, and there is movement and sensation as you move back in the brain, and kind of on the side is where memory is processed and stored. So sometimes when people have a degenerative disease or some cognitive impairment, some changes in their memory, maybe they have Alzheimer's or a different form of dementia, oftentimes you'll actually see on CAT scan or MRI imaging that there's actually changes in the frontal lobe here, which we know deals with thoughts and planning and processing, and also the memory, which can be on the sides of the brain there. So the brain anatomy actually can change and shrink a little bit, and that can affect how our nerve cells or neurons in the brain are processing and firing, and then what's happening, and that's why someone's memory might be affected. So that's why that could happen. Let's look past the thinking wrinkles I think we talked a little bit about the blood supply, how the brain takes up so much of our blood supply. With each heartbeat, your arteries can carry about 20 to 25% of the blood in your brain, where billions of cells use that to carry the oxygen and fuel to your brain. When you're thinking hard, your brain may use up to 50% of the fuel and oxygen. So it's really true what they say. You can see the steam when you're thinking. That's almost double what the normal blood flow would be when you're really thinking and trying to work out a problem. That's kind of interesting, actually. Let's see. We already talked about the thinking wrinkles. All right, so we've all heard about the brain being divided, and you can see in my model, it's really hard to put back together, so I just kept it separated for us. But it is actually split in two sides of the brain, and there's this bridge of it's called the corpus callosum that actually keeps the two halves together. And as we said, some of you may know of someone that has had a stroke or a brain injury, and we know that one side, your right side, would affect your left-sided movements, and if it's damage on the left side, it could affect how your right side is either maybe weakened or the movement is challenged because of some damage done there. So it's kind of that opposite thing. But there's also, it's interesting that most people, the language is chiefly on the left. So you ever heard of people who say, oh, I can't do math and I can't do analysis and I can't do this? And there's theories about people utilizing one side, one half of their brain more than the other, the scientific versus the artistic people. You've heard that talked about too. Let's see, so nerve cells, they actually call it the Neuron Forest because the nerve cells are all the cells that are firing and misfiring and hopefully not misfiring too much. But they actually do kind of look like a forest. Have you ever seen a nerve cell or a picture of one under a microscope? I have a picture, but it's not really, they're kind of strange looking. Yeah.
Yeah, they're on where it just shows it all lit up.
Well, there's a lot of branches. These nerve cells are pretty complex and they can do some pretty complicated things, but they are pretty, they actually do look kind of like a forest or branches. And they are all signals from memories and thoughts move through an individual nerve cell as a tiny electrical charge. So it's actually pretty fascinating. I don't know if any of you were back in February when we talked about the heart and we talked about minerals and metals and electrical charges and the natural pacemaker of the body. But it's interesting that the heart is electrical and so is the brain, all of that. So it's kind of fascinating when you think it, yeah, it's kind of fascinating. Nerve cells connect to one another at synapses, or basically it's a joint. When a charge reaches a synapse, it may trigger release of tiny bursts of chemicals. These are called neurotransmitters, and they travel across the synapse, and that's how basically there's picture like two little fists like there, and that's the synapse. And so it's an electrical charge basically that makes the memory or the thought jump from one to the other, and that's how it gets passed along, which is kind of interesting. All right. So let's move on to your second handout, which looks like this, talking about engaging your brain. These are just things, general things that we can do to try to keep our brain healthy, especially as we age and we know that there are changes in how our memory is or our balance and these normal age-related changes, but then there are other people that, they have more challenge with memory or processing, and how can we try to keep sharp? So this little guy here, this little thumbs up brain at the top, says it's important to engage your brain. Eat healthy, low-fat, well-rounded diet, lots of veggies and fruits, strawberries, blueberries, broccoli, they're all good for your brain. I think we were talking about fish being brain food before, and we used to say that. Get moving, walking, and that helps with all things. We talked about our exercise chapter that we had that discussion, but just blood flow and movement, and that uses all different areas of your brain, and especially that movement part. Think of it as a muscle that needs to get worked and used and exercised. So moving and being physically active is perfect for getting not only the blood flow and those nutrients to the brain, also it's associated with a lower risk of having or developing brain issues later on. Stay connected. There's a little telephone icon there, really just reminding us to stay social with people. As human beings, and and again, looking at some of those CAT scan and MRI pictures that some of the research shows, you can actually see the changes in the brain as someone's engaging with someone socially, emotionally, or working out a math problem. And it really is exercising that brain in a way to keep those synapses firing, keep things going and moving in the way that they should. So practice and keep working that muscle. Blood pressure. High blood pressure can have serious effects on your brain health. If your blood pressure is high, get it under control. It may help reduce some of your risks to your brain. So obviously, you guys, most of you here come and get your blood pressure checked on a regular basis. We all kind of know that blood pressure is important. But what's the risk? What is it about blood pressure that can affect your brain? If you had high blood pressure and it was left untreated, what could happen specifically to your brain? Stroke. And there's a couple different types of strokes, and since we have a nice brain here to look at, there's actually something called an ischemic stroke, and that's just a big long fancy word for a lack of oxygen. And sometimes that's because there's a part here that's blocked. So one part of the brain, depending on where that little lack of oxygen supply happens, that would be the part that might be affected. So if it just so happened that it was over here in the memory section, maybe you'd have more trouble with your memory after having a stroke. There's another type of stroke that's it's called a hemorrhagic stroke, which actually means there is a bleeding in the brain. So sometimes that happens because of blood thinners, or someone had the high blood pressure and it was not in control, or some people just are born with different blood vessels that have a weakened wall. Blood vessels are just muscles, and so it could just been something you were born with, a weakened blood vessel up there. And again, depending on what part of the brain is affected, or there might be a bleed in there, that could result in a stroke, which could result in some lasting effects. They've come a long way with treatment, and I think people are much more aware to keep the blood pressure under control, get it checked. Diet, exercise, reducing the salt, reducing stress, all are wonderful ways to reduce the blood pressure and therefore reducing your risk of stroke. The other thing is, I think people are also more aware of the symptoms of stroke, right? Maybe someone's getting more confused or mentally cloudy, or have you ever seen that, the acronym, the FAST, that someone's face, you have them smile, and if one side is lopsided or it's droopy, or have them raise their arm, the A is for arm, and if they can't hold it or it lists, and we want to move speech. If the speech might be garbled or they're not really making sense, something's not right. So it's time is of the essence to call 911 and get them seen. And because we don't know what kind of stroke it is and then where it's happening, but now there's a lot of immediate treatments that can stop that process, and people may have less lingering effects from a stroke.
What happens when you've lost your speech and you're garbled, but then it recovers? How does that happen?
So I think any time that anything like that happens, someone still needs to get evaluated as soon as possible, because you don't know why. It could have been a stroke. It could have been a smaller stroke, which you might have heard the term TIA, which is trans ischemic attack, and some doctors will say a mini stroke or a little stroke, and it comes and goes. And so it didn't stop and continue on, it kind of came and went, but it still did something. And I think it's important to know, because typically once someone's had one stroke, they're more at risk for having others. So it's important to know what that was, and they can tell, or your doctor can assess and do further diagnostic testing to see if it was a stroke, or give you their best clinical idea of what they think. The other thing is that some of those symptoms are actually could be someone's electrolytes are off. I've seen someone who actually, we didn't know if they were having a stroke, but it was actually the sodium level was actually very, very low. And remember, sodium and potassium are metals, and we talked about conductivity and electricity for the heart and the brain. So that can affect someone's speech and garbled, and they may seem cloudy or kind of confused. So we don't know why. So the bottom line is it's important for them to get checked, because if their sodium level's low, then there's something that they can immediately do about that and remedy it right away. If it goes too low, also, it can affect their heart and their brain function. So you wouldn't want to mess around either way. And then in terms of a stroke, if it is, it's best to know what it is. And also you want to prevent further damage. So the best thing is to get seen right away, because the best chance of reducing any further lingering effects from a stroke would be to get treatment right away. So tough to say. It could have been a couple different things, but good question. So
Can that be inherited?
what's that?
Inherited?
I
Can a tendency be inherited?
Yes, I think that there is definitely a hereditary factor with, well, usually like high blood pressure and stroke and heart disease they've definitely found that there is a genetic component to that, as well as lifestyle. So if you do your part and you try to, take care of the lifestyle issues that you can control, and then, obviously we can't control our genetics, but we can control the things that we can: diet, exercise, keeping our brains engaged, monitoring our blood pressure, keeping active, and reduce our stress, all those things. And in some cases, some people need medication, and there's just no way around it, So taking medication as prescribed and following up with your doctors is important. So I like when you flip that page over and it looks like lollipops or something there. It says, discover a new talent. When you learn new things, your brain is engaged in a different way. And I really liked, pick up, oh, is that what it is? It didn't look like, it looks like lollipops to me.
Like, what are you talking about?
I don't know. What do you guys think? It looks like lollipops.
Lollipops?
Yeah. Right? Do you see it?
It does look like lollipops.
Yeah,
If it was bigger, you'd see it. It looked like.
You can tell where my brain is. I'm always a sweet tooth, so. When you learn something new, whether it's a sport or a hobby or dancing or a new language or anything, you're challenging your brain in a new way. It's going to get increased blood flow, we know, right? Because if you're thinking really hard, it goes up by half. And then it's just challenging and rerouting those synapses and hopefully, creating a new energy there to keep it active and healthy and that muscle used the way we need to. So, and good rest and sleep is important for that regeneration. So that's important to get the sleep. So I have this other these were some exercises we found about different ways to keep your brain engaged. And I really liked the one that talked about use your other hand. Are you right-handed or left-handed, most of you? Right. Are there any lefties? No left? So right-handed, try eating your dinner with your left hand, just to mix it up. It's not easy, first of all, but it's also, what's it going to do? It's going to, if you're right-handed, stimulate the other side and just do something different. Someone said use chopsticks when you're eating. That's a fine motor skill that's not easy. But just those little things that you can do to kind of make your brain work differently. Someone also had suggested if you drive every day to the Council on Aging, take a different route once in a while. Because we all you call it spacing out, or all of a sudden you're just driving along. You're not even really thinking about where you're going anymore because you're almost on autopilot. Well, force that brain to work and take a different route maybe once in a while just to mix it up a little bit. Let's see, what were some other suggestions? Switch hands, eat with chopstick, read books aloud. Why do you think that would be? There's a lot going on when you're reading aloud. Because first of all, you have to read it and you have to process, and then you have to actually speak it, and then you're hearing it. So you're engaging multiple senses. So if you read to a young child, grandkids, or borrow someone else's grandkids, or volunteer at the library, or the classroom sometimes will have adopt a grandparent day, or come in and read to the kids, or work with the reading teachers. Or just read aloud to yourself, if you like the sound of your own voice. Let's see, take new routes, try new things. We talked about that. The other thing is staying engaged, but I know Bud all the time likes to do his puzzles, word puzzles, crossword puzzles, word searches. We're going to do a game where I'm going to see how many different words you guys can make from my word behind me there in a minute. Just to challenge yourself and to be thinking, to increase that blood flow and exercise your brain. And there's reasons. I mean, we do it because it's going to improve your memory or at least maintain what you have, reduce stress, and then boost your motivation, productivity, those social connections, positive mood. It can give you an overall sense of well-being, improve concentration and focus, sharper vision, hearing, self-confidence, reaction time. That's another thing that is a normal process of aging. Unfortunately, our reflexes and our reaction time is slower. So if you want to halt that process a little bit, it would be great if you practice some of those, engaging your brain. And the more you exercise it, the better chance you have of reducing that from happening as quickly, hopefully. So that's, I think, what I got. Anyone have any comments or want to share anything? Nobody, huh?
I want to say something, but I'm eating my brain.
That sounds so cannibalistic. Yes.
This is a little on the light side, but also true. Sometimes my wife and I will approach a problem from a different angle. I'll say, well, we should do it this way. And she says, well, we should do it this way. And we joke, but it is actually sort of true. Left brain, right brain is what
Right.
we end up saying.
It's funny, like some people describe themselves as being very verbal and, I like to read, I like to talk, and then other people consider themselves more analytical or they're really good with maths and sciences. And usually people there's two camps divided, but in actuality it all works. But it is true how it seems like there are definitely, people who do the different perspectives, and that's what makes it interesting, I think.
Yeah, I'm ready now.
Okay, we're ready too.
I've had shingles in my life, a bad case.
Yeah.
And there are, proof that there are charges, electrical charges in your body, because when pain would come, it's those nerves.
That's
The
right.
damaged nerves. And it made you jump. I actually would jump with the charge of it.
Yes, and so you bring up a good point about shingles. Shingles is basically the herpes zoster virus, and the same as chickenpox in a lot of ways. But what happens is someone who's you don't get shingles unless you've had chickenpox, right? So what happens is as kids, we had or younger in our lives, we had chickenpox. And we had it, and we were sick, and we were itchy, and we put the calamine lotion on, whatever we did, got over it. But what happened is that virus stayed lying dormant in your nerve cells. So it's still there. So you're immune basically to chickenpox, but not to the shingles. So, and they're not exactly sure. There's theories that part of the reason why we develop shingles typically later in life is because maybe it's stress induced. A lot of times that's what doctors feel, is that stress on the body, whether it's physical, mental, emotional, can cause a flare of the shingles. We're not exactly positive why all of a sudden you have a shingles outbreak. But it's very true. It does impact the nerves. That's why for some people it's very painful, and there are actually specific medications that are given to dull the nerve.
Not that much. There's not much treatment of it. You have to go through it.
There is pain. Yeah, and some people, unfortunately, specifically to shingles, it's very serious if it's on or around or near your face and your eyes and your ears. No messing around. You see some sort of lesions or anything anywhere near your eyes, you go get checked right away. The distinguishing feature of shingles is that it's one side of your body.
You won't cross.
It doesn't, right, because it's the nerve branch, right, that neuron forest we talked about. So it's one side. Historically, hallmark, it's actually in the shape of a shingle, usually a rectangle on the trunk. Not always, though. You can have them anywhere on your body, but a lot of people do get them on the trunk, and it's the blisters, and the blisters actually pop out where the affected nerves are, and it can be painful before you even see a lesion or a blister pop out, and you're wondering why your skin is sensitive and painful.
I used to ask my daughter, so itchy back here,
Yeah.
let's see, what's this like? Could you see if there's anything there? She said, there's nothing.
Yeah.
There. But she kind of patted for me and felt better. But about a week and a half later, it broke out. It was shingles.
Yeah. And so the thing with, first of all, there's a vaccine for shingles, and if you haven't had it,
everyone should get it.
I would recommend it.
It's terrible to go through.
And if you do get checked right away, anytime, especially if you see, and it looks almost like a chicken pox. It's like a little blister, and they scab and they dry out just like chicken pox do. Some are itchy, some are painful, some are both. You can have a low-grade fever. You can just feel all around just not great at all. The problem is a complication of shingles is pneumonia, and a lot of people don't know that. So, you want to be really cautious about that. So there are definitely pneumococcal vaccinations or pneumonia shots. There's actually 2 recommended for anyone over 65. If you haven't gotten them, talk to your doctor about what you need, when. Because that can help you not only from flu, but from shingles. And then, like I said, you could develop pneumonia. You can get shingles more than once. It's not that common, but it can happen. And then people ask the question, in fact, Susan got a call or was asked this week or last week about, I have shingles now, can I get the shot? Right? So what usually, you will have, your body does build a natural immunity once you've actually had a disease and an illness. But a lot of providers, healthcare providers, will still recommend you could get the shot, but you don't need it right away because your body has built some natural immunity. But it's still a conversation you should have with your doctor.
I had the shot years and years ago, and Acton, is it still good?
So, they haven't changed the recommendations. The recommendations were 1 shot after 65, and that was it. What I see over time with research is that sometimes they will change the recommendation as they might see people flaring up or having breakthrough cases.
Yeah.
So as of right now, it's a one-time lifetime dose at the age of 65 or older. I think they actually lowered the age now so that
I think it was
insurance will cover
60.
it.
Did you
Yeah.
have it? No. We
Yeah.
went to Acton together.
Yeah, so there is a vaccine for it. I would recommend, if you haven't had it, to talk to your doctor about it. The other thing is, if you develop any symptoms, go get seen right away, because especially if it's on your face or near your eyes, there are medications they can give you. Sometimes even people require some steroids to reduce the inflammation on those nerves. And then there's a nerve medication, and they'll give you an antiviral medication as well, typically. So be aware of it, advocate for yourself. Now, you cannot pass shingles to shingles. So what happens is, when those vesicles or those blisters, if that rash breaks out, if someone who has never had chicken pox has direct contact with those lesions, they could develop chicken pox. But you don't pass shingles to shingles. It doesn't work that way. So most people are protected, and nowadays kiddos get a vaccine. There's a vaccine for chicken pox, so it's pretty rare. However, especially around pregnant women, you want to be real careful about that. And people can go out and about. There's no need to isolate or quarantine yourself with shingles. Usually it's in an area that can be covered, and that no one's going to come in contact with it. And then once those lesions dry, you're fine. So that's the shingles. I'm glad you brought it up.
You're still in pain, but you're fine.
You're not contagious. Yeah, and it is sad. Some people do have that lingering, they call it neuralgia, because N-E-U-R is kind of the root word for the
I've had
nerves.
it for 3 years.
Mm-hmm.
I could tell you where it's hurting in my back right now.
It's a terrible thing
But it's not shingles, it's post-traumatic
Yes,
neuralgia.
exactly right. And not everybody has that, so I'm sorry that's too
It's
bad.
terrible. It looks like it's going to be a lifetime.
Have you had
And is there anything that makes it better for you?
Gabapentin,
Yeah.
but at one point I was overdiagnosed, oversupplied with that.
Yeah.
4 pills a day at 100 milligrams each. And I went into the bathroom, and the shower stall started coming at me. And it made me dizzy from having too much medication.
Oh boy,
Well, that landed me in the hospital because I fell.
I bet.
Instinctively, you go up like this
Yeah.
with your arm. I was walking in with a cane, but it wasn't a wet floor or anything.
Oh.
The amount of medication I was on. So I'm on 1 gabapentin now at night. At night is especially hard. Even in cold winter weather,
Yeah.
you can't stand anything on the side that was attacked if you have this post-traumatic neuralgia.
And so neuralgia refers specifically to pain, but there are other things where your nerves are involved. maybe some of you have heard the word neuropathy, which again, we've got that root word, this neuro here always refers to the nervous system or the nerves. And so neuropathy means there's something wrong with the nerves. Usually it's in the lower extremities. Sometimes it's a part of someone having diabetes. Sometimes it's just a vast, it has to do with your veins and your arteries and capillaries. And sometimes it's just neuropathy for neuropathy's sake. And so it's not only pain, but sometimes people may lose sensation in their feet or their extremities, their fingers or their hands. They may not be able to tell temperature, like hot, cold, or they may just lose feeling, or they may have that pins and needles tingly feeling, the numbness kind of that you get if you laid on your foot wrong and it fell asleep and then you went to walk and that's that feeling.
Have to wake them up.
Yeah. So
Does it have anything to do with the brain?
What was that?
Does neuropathy have anything to do with the brain?
Usually it's I would say it's usually the nerve cells in the extremities that are affecting that. So yeah, yes, exactly. So, but it could be different. It could be for different reasons, which is why if you were to have any of those symptoms, you'd have to talk to your healthcare provider about what's causing it. Is it maybe your blood sugars are not in control? Is it, some other reason? Did you have some sort of damage? Or figure that out with your doctor together, and then they can best tell you how to work with it. So I always recommend if anyone has that, it's really important that you're mindful of your footwear and that it's secure, slip resistant, ties up, and take a minute to get your bearings. As you said, you kind of have to wake them up. When you stand up, don't stand up and try to step at the same time. You stand up and give your body a few minutes to acclimate to the new position. Let the blood flow and the nerve cells get used to where you are and where you're trying to go. And then the other piece is don't go barefoot because you may not feel that you've cut or nicked yourself. And sometimes with peripheral neuropathy, sometimes it's a circulation issue as well. So very often that may go hand in hand. So someone with neuropathy, they may not heal as well as somebody else because circulation. I mean, your feet are the farthest from your heart and that blood supply. So that can be another challenge. And if you get a nick or a cut on your foot because you were barefoot, you may not feel it, and the next thing you know, you could get an infection. So don't go barefoot. Make sure your shoes fit properly, they're laced, not too tightly. Watch for spills, watch for glare, and use good lighting. You just have to be extra cautious, when you may not have full sensation in your feet. And then the other thing is temperature. Some people can't tell if it's getting too cold, or they may put a heating pad and then next thing you know they're getting burned because those nerve cells and the perception is not what it used to be, or it's different than, it's not telling you, oh my gosh, that's too hot, get it off your skin, you're going to burn. That's a problem with the brain and the nerve cells and the communication. So, yeah.
I was listening but not listening. Did you say have someone else inspect your feet?
So I think there's a couple things on that. It's not always practical because sometimes people live alone. So what I suggest is get a handheld mirror if you live alone and put your foot up on a chair, put the mirror there, good lighting, and you can inspect the bottom of your foot that way. If you have someone, for sure, it's always good to have a second set of eyes looking at your feet. But feet inspection, particularly for people that have diabetes or are at risk for diabetes, is really important. And then even, a foot doctor to look at that. So yes, if you live alone and you don't have someone right there readily available to look at your feet, there's a way that we can still do that, and take a mirror, look, good lighting, and you should be able to inspect your feet.
Yeah, sad story. An acquaintance of mine who has since passed away, he was diabetic with neuropathy. He was in a pool, went barefoot, walked across the hot cement, and he ended up losing his foot.
Oh.
So, I mean, that's extreme.
It's real. It definitely happens for sure, and I'm so sorry to hear that. It's a terrible thing, but it's definitely real. So some people, when I say these things, they sound like just common sense. Of course we do that. We don't do that. But, you know, it's real and these things do happen and, you know, you're just going about your day and, you know, so it is important to just be aware of that. So thank you all for listening to that. Any other questions or comments before we get into trying to exercise our brains and think of words? Rhymes with dearie.
Oh.
And you still...
What was it?
Eerie.
Yes!
Yay!
What was it?
I thought you said.
Scary.
Scary, oh, okay.
Scary.
Okay, here's one for you.
Okay.
And this is a sorry state of affairs of our country, but